September is Childhood Cancer Awareness Month and a time for us to remember a group of serious conditions that affect around 2,500 teenagers and children every year. The 5 most common types of cancer seen in children are leukemia, brain and other central nervous system tumours, neuroblastoma, Wilms tumour and lymphoma. Because the types that affect this group are different to adults and because they are relatively rare, they can be very difficult to diagnose. Different cancers will affect different ages, but by far the commonest is a type of leukemia called acute lymphoblastic leukemia, or ALL, which accounts for almost 1/3 of childhood cancers. ALL is a cancer of the blood. Normally, the different types of cell in our bloodstream, which includes red and white cells, are made in the bone marrow. However, in ALL, the bone marrow makes abnormal white cells that don't work properly. These cells can't protect you from infection, they can overcrowd the bone marrow, affecting the production of other cells, and they can travel around the body and accumulate in other areas. Symptoms of ALL include anemia, or looking pale because the bone marrow is overwhelmed and can't make enough red cells, excessive bleeding and bruising because it can't make other cells that help the blood to clot, swelling of organs like the liver and spleen in the tummy because of accumulation in those, and difficulty fighting off infection, which could manifest as recurrent or prolonged fevers. Diagnosis of ALL involves blood tests to look at cell numbers and appearance, scans of organs, and the possibility of taking a sample of bone marrow called an aspirate or biopsy. Treatment can include medications to control symptoms and effects of the illness, chemotherapy and radiotherapy to target the cancer, and surgery such as bone marrow transplant. Fortunately, improvements in treatment have resulted in much better survival rates of ALL and other types of cancer too. 50 years ago, 3/4 of children diagnosed with cancer died. Today, more than 3/4 will survive. With proper treatment and follow-up, survival rates for ALL are currently 92%. Cancer's an extremely scary word to hear, especially for a child, a young person or their family, so we must be very careful when we diagnose it. However, diagnosis can be difficult as the symptoms of cancer in children are actually much more likely to be due to more common, less serious conditions. That's why it's important to see your doctor for a review if your symptoms persist or don't get better. For more information, please check out the Childhood Cancer Helplines on This Morning's website.